Welcome to the Patient Assessment Management Trauma Skill. In this skill, you will have 10 minutes to perform your assessment and voice treat all conditions and injuries discovered. You should conduct your assessment as you would in the field, including communicating with your simulated patient. You may remove the simulated patient's clothing down to his or her shorts or swimsuit if you feel it is necessary. As you progress through the skill, you should state everything you are assessing. Specific clinical information not obtainable by visual or physical inspection, for example blood pressure, will be given to you only when you ask following demonstration of how you would normally obtain this information in the field. You may assume you have 2 partners working with you who are trained at your level of care. They will correctly perform the verbal treatments you indicate necessary. I will acknowledge your treatments and may ask for additional information if clarification is needed. Do you have any questions?
No questions.
Okay. You respond to a residence and find a 40-year-old male lying on the sidewalk in front of his house, next to an overturned 24-foot ladder.
Okay, so we're arriving on scene, got my BSI, scene safe. MOI appears the guy fell from a ladder. How many patients?
You have 1 patient.
Okay, I'm going to call for additional help. Have my partner grab C-spine. We're going to collar him. What's my general impression, level of consciousness, and chief complaint?
He's unresponsive.
He's unresponsive?
Yep, with bleeding from the forehead.
Okay. At this time, I'm going to open his airway, insert an oral adjunct.
He takes it.
He takes it, okay. What's his respirations at?
28.
28, okay. I'm going to have my partner auscultate, listen to lung sounds, they clear?
They are clear.
Okay, so at this time, I'll put a non-rebreather on him and high flow O2. I am going to check his skin color and temperature.
Pale, cool, and moist.
And what about his pulse?
Weak and rapid.
Okay. So is there any signs of major bleeding?
No.
No. Okay. So I'm going to start by treating for shock, put a blanket on this guy, and this is definitely a load and go, just based on his level of consciousness. I'm going to have my partner obtain baseline vitals.
Your initial vitals come back at 72/60, pulse of 138, respirations 28, and O2 sats at 92%.
I'm going to attempt to obtain a sample history from anyone nearby.
There's nobody around.
Nobody by. Okay. I'm going to move on to my secondary assessment, checking for any deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling. Checking the head. Do I find anything? Any bleeding?
You have a 2-inch laceration to the right side of the forehead.
Okay. I'm going to check the eyes. Do I see anything?
They're equal but sluggish.
Okay. Nose. Checking the nose and the ears for any bleeding.
There is none.
What about the mouth? Any bleeding? Teeth intact?
Teeth are intact.
Okay. Checking the neck for any JVD tracheal deviation.
None found.
Okay. Checking the back of the neck. Surface fine.
No, it's good.
Okay. I'm going to cut the clothes off this guy. Inspect the chest, any crepitus.
No.
Okay. What about the ribs?
You notice some bruising under the right side of the rib cage.
The right side, okay. I'm gonna listen to lung sounds.
They're equal.
Equal, okay. I'm gonna inspect the abdomen, palpate the abdomen.
What are you checking for?
Any rigidity or tenderness.
Nothing noted.
Nothing noted, okay. I'm gonna check the pelvis. Any crepitus found?
It's stable.
Okay. Cut the pants off here. check the pelvis for any crepitus, checking the genitalia,
Nothing noted.
okay, checking the legs. Anything CMS intact?
CMS intact and nothing on that leg.
Okay. Checking the other leg. Anything found?
You notice a closed angulated deformity to the lower leg.
Okay. CMS intact.
It is intact.
Okay. Continue with the arms. Checking the arms. Anything found? Any
Nothing
bleeding?
found.
Nope. Okay. And then checking the other arm. Anything found? It's got CMS intact.
CMS is intact.
Okay. This time, we're going to get him on the backboard. I'm going to sweep his back, checking for any.
Nothing found.
Nothing found? Okay. Once we get him on the backboard, we'll get him in the ambulance. Alright, so I'm going to start managing my secondary injuries. I've bandaged his head, splint his lower extremity fracture, checking CMS.
CMS is
I will
intact.
also be placing him on the cardiac monitor, pulse oximeter. I'll get 2 large bore IVs, and also give him fluid bolus to pump his pressure. I will put him on the end-tidal CO2 and reassess every 5 minutes. Get another set of vitals. Did anything change?
Your vitals come back at 92/74, pulse of 118, respirations 22, and O2 sats are 96%.
Okay.
Do you have anything further?
Nope.
Okay.